I'm Renee. I'm Dr. Gazelli's physician assistant and second pair of hands during surgery. You're getting ready to have a lumbar microdiscectomy or microdecompression. Today I'm going to walk you through the procedure and recovery time from start to finish. Please feel free to take notes. I'm always happy to go over questions that you have or go into more detail with you face to face. This is not meant to be comprehensive, so I do expect that you'll have questions, but hopefully it gives you a good amount of information about the procedure, the recovery time, and the day of surgery. So in the beginning of the day, you'll be brought back into the pre-op holding area, and the nurses there will start an IV and get things prepped and ready. They'll make sure that all medications and medical history are updated into the computer. You will see the anesthesiologist in the pre-op holding area, and they'll even sometimes call you the day before. So oftentimes if you get a call that day before surgery from a number that you don't recognize, you may want to pick it up because it could be that anesthesiologist just trying to chat with you and get to know you a bit. You'll also, of course, see Dr. Gazelli in pre-op holding as well, so he's happy to go over any questions that you have at that time. As far as approximate time of the procedure and what your family should be expecting, typically a one-level microdiscectomy or microdecompression will take us about 45 minutes to an hour. If you're having more than one level done, you could add about 20 to 30 minutes per level of added time to that 45 minutes to an hour. We're always happy to keep family or friends or whoever is there with you updated during the procedure. The nurses in the operating room can call them, and Dr. Gazelli, of course, will call them and come see them to talk to them after the procedure. If they're there at the facility, he's happy to sit down with them face to face. If they can't be there at the facility, that's fine as well. He's always happy to call them on the phone and talk to them and tell them how things went as well. As far as what happens in the operating room, you've probably already reviewed the procedure video, so you may be well informed about the procedure itself, but this will give you a little recap of the procedure as well as some commonly asked questions that people have. The surgery is done under general anesthesia, and after you're asleep, we're going to have people in there monitoring your nerves during surgery, so they're going to put little needles all over from head to foot, and again, those are placed after you're asleep. And those monitor the nerves while we're operating so that if a nerve starts acting abnormally, they will let Dr. Gazelli know right away. So I also mention them because I like to warn you if you wake up with pinpricks, bruises, or bleeding, that's what that was from. The incision that we make is typically in the middle of your low back, and it's typically a pretty small incision, maybe 1 inch to 2 inches. Once we make the incision, we'll pull the muscles aside and get down to the bone. And at that point, we'll bring a microscope in so that we can see everything nice and clear. We'll remove any bone, ligament, disc material, bone spurs, any overgrowth, degenerative overgrowth, anything that's pressing on the nerves gets removed so that we can make sure that the nerve is floating free and completely freed up. Once we're confident that the nerve is freed up and nothing is pressing on it any longer, then we can go ahead and close the incision. The incision is closed with layers of dissolvable stitches typically. The top layer is a dissolvable stitch as well, and I do leave a little looped knot at the top and the bottom of that. If you or anyone sees it, it looks like clear fishing line, and then there will be steri strips or white skin tapes over that incision as well. Once that is completed, we'll put a gauze bandage over the wound, and then the surgery is done. As far as in the recovery room, the nurses there will watch you and monitor you closely, making sure that you're waking up okay. They'll help control any pain that you're having and discomfort that you're having. They'll make sure that you're getting up and moving and walking okay before you're discharged home. Sometimes we put a drain in after surgery, so if that is the case for you, the nurses in the recovery room will watch that drain, and as long as it's very little drainage, it will get pulled out and removed prior to you going home that day. If for some reason, however, the drain is draining a little bit more than we're comfortable with them pulling it, they will actually leave it, and you can still go home that same day, but you would just go home with the drain, and then we'd ask you to come back in our clinic the following day for us to remove it. That doesn't happen very often that we have to send patients home with the drain, but occasionally it has happened, so of course I want to mention it to you so that you're prepared. As far as getting you home and discharged from the facility, Typically it is an outpatient procedure and you will go home once you're awake, your pain is relatively controlled, and you're getting up and walking okay. We always want to make sure that you have pain medications and muscle relaxants for you to use at home, and oftentimes we will give those to you at your pre-op consent visit in our office. So hopefully you've gotten those ahead of time so that you can fill them, and they'll be waiting for you at home so nobody has to worry about getting them filled on the day of surgery. And we typically always give you antibiotics during the surgery, so we will not send you home with antibiotics. It should really just be the pain medicines and muscle relaxants that you're given, and those again are just as needed medications. As far as if you do end up spending the night in the hospital, and as I said before, it typically is an outpatient procedure, but if for some reason we ended up keeping you overnight at Rose Medical Center, you will be staying on the spine and orthopedic floor, and there are nurses and physician assistants that work on that floor specifically so they know how to treat both spine and orthopedic patients regularly. You will be in a gown most of the time that you're at the hospital, but you're welcome to bring any comfortable, loose fit clothing to wear or at least to go home in when you do go home. You're always welcome to bring your own toiletries or things like that from home as well. All rooms are private, so you should not be sharing a room with any other patients. And while you're there at the hospital, you will see Dr. Gazzelli or myself on a daily basis. If you are there on a weekend, you'll see Dr. Gazzelli or myself or one of our other surgeons or physician assistants that would be on call that weekend seeing all of our inpatients. As far as what to expect initially after the surgery and the restrictions that we ask that you follow, as far as activities go, walking is going to be your main activity in therapy for the first 6 weeks. So I want you alternating positions after surgery. I don't want you bedridden or chair-ridden at all. You'll be up and moving the same day of surgery. And if you're at home just hanging out, watching TV or reading, I would like you to get up every 45 minutes to an hour. Make sure that you've walked a little bit. Even if it's just around your house, go to the bathroom, get a drink of water. If it's nice out, feel free to take little walks outside, and initially keep it to multiple short little walks throughout the day. As you're feeling more up to it and feeling a little bit less discomfort, you're welcome to lengthen them to fewer, longer walks. But again, walking is that main therapy for the first 6 weeks, so we do encourage that. The other restrictions that we have you on are no bending, no twisting, and no lifting about more than 10 pounds. And again, that is going to be for the first 6 weeks. We really don't have you do much in the way of any other exercising. Oftentimes you'll wake up with white stockings on your calves and feet. You can go home with those. You really don't have to keep wearing those once you get home unless you're not getting up and walking enough, or if you're having any swelling in the lower extremities, then you probably should continue to wear them. But in most cases, patients don't need to wear them once they've gotten home. As far as showering and wound care, I mentioned that you'll have the steri strips on the incision and the little loop knots of suture. All of that can get wet in the shower. So starting the second day after surgery, so about 48 hours after surgery, we'll let you start showering. And you'll actually go ahead and take the outer gauze bandage off of the incision and shower like normal. Letting the soapy water trickle down your back to kind of gently cleanse it is perfect. Just don't let the water pound on the incision and don't scrub on it. Don't let the incision soak under a pool or a bathtub, just showers only. And once you're done with that shower, just feel free to pat it dry and put a new dry gauze bandage over it. There's no need for any ointments, creams, lotions, or anything like that to place on it, so just keep it clean and dry. As far as with the medications that we have you on, both from what you've gotten during the surgery and then if you're taking pain medicines at home, sometimes those medications can kind of slow your belly down a bit and cause some constipation. So we usually do recommend that patients take stool softeners as long as they're on a narcotic or a pain medication. Of course, if that's not enough, you can always step it up to laxatives as well. And of course, if you get the other and switch over to diarrhea, then please go ahead and back off and stop the stool softeners or any laxatives that you're having or taking. As far as driving goes, we do ask that you not drive as the driver up to maybe the first week after surgery. You can ride as the passenger for short little trips, that's fine. But we don't want you behind the wheel with all the stronger medicines you were given during surgery, and if you're taking pain medicines during the day, you really should not be behind the wheel. Typically, once we see you back at that first post-op visit, we'll chat more about that driving and usually get you cleared from driving or to drive. And then as far as work goes, if you have an office type sedentary job, usually I would anticipate you take maybe up to a week off, sometimes less. But within that first week to 2 weeks, you should be back in the office. You are welcome to work from home if you have that capability at any point, whenever you feel clear enough in your head to do so. And then when you go back to work, whether it's a week later, 2 weeks later, or however long it is, we do usually advise patients to see if they can go back part days at first, if you have that capability. The reason being is that with all the medications that you're on, you'll feel a little bit wiped out and exhausted pretty easily. And so if you try to go back to work a full 8 to 10 hour day right after surgery, it's often too much for you. So if you're able to go back that first week back to work, part days, and then advance to regular full duty or full hours, then that would be usually best for you. Now, as far as people who have more physically demanding jobs, like construction workers or anyone that just has to work more physical, usually you're going to be out of work longer. Because we restrict you for the first 6 weeks and then need to get you through physical therapy to strengthen you back up before we'll clear you to full duty, it can be 2 to 3 months until you're back to full duty after this procedure. As far as complications to think about with this procedure, as far as incisional pain goes, you will have some of that just from the disruption of the muscles and the skin. You are welcome to use heat or ice over the bandage, and then of course we give you the pain medicines, and muscle relaxants oftentimes can be very beneficial. If the muscles are spasming or tensing up, those muscle relaxants can help oftentimes better than pain medicine alone. You are also should be expecting to feel some of that back discomfort for about 4 to 6 weeks or so as those soft tissues are healing, and then maybe even a little bit longer than that as we get your back strengthened back up with physical therapy. Because of the incision and moving the muscles, we've weakened that core, that internal core muscle group, and so that's where you get that discomfort and feel that back aching for a little while. Oftentimes you may also notice some lingering nerve symptoms. Our hope with this surgery is that patients wake up with less severe or less frequent nerve symptoms, but I always tell patients it's completely normal if you don't have 100% resolution right away, because once we've taken the pressure off the nerves now need to heal, and nerves do heal slowly, so we just need to give them time to recover. So again, the hope is that things are much better than they were prior to surgery, but okay if there's still some lingering symptoms in the leg or foot. Having said that, some people do wake up with almost complete resolution of pain, and that's wonderful. But don't be alarmed if you have some continued symptoms. Now, of course, on occasion, a nerve can get aggravated that we were in there and actually gets flared up after surgery. So a patient could wake up with the same level or increased level of nerve symptoms as they had prior to surgery. And this could be pain, numbness, tingling, weakness, any of those. And if you did wake up with increased symptoms of any sort, we would be using some medications to help calm down that inflammation and stabilize that nerve. Again, this does not happen commonly, and it's pretty rare that this happens, but it can happen, so I like to warn people about that. The other thing I like to talk about with patients is a dural tear. The dura is the sac that holds the spinal fluid and the spinal nerves. It's a thin membrane, sometimes a sharp piece of bone or an instrument could put a hole in it. If that happens, we'll see the spinal fluid leak, so we'll sew it up right then and there and put a little gel over it to seal it. Typically, it does seal up on its own without any long-term effect to you. However, we do usually make you lie flat for a couple of hours up to overnight, depending on the extent of tear. So typically, it just slows us getting you out of the facility. It might not extend your hospital stay or your stay at all, but it might just be a little bit later than you had first anticipated. The other difference I like to mention to people with that is that if we do have a dural tear on the very top layer of the incision, instead of a dissolvable stitch, I will use an outside stitch. It is just a difference of a stitch. You don't take care of it any different than the way I've already described. It's just a different stitch for us to take out at your first post-op visit. And the last thing I'll chat about is a wound infection. Typically these incisions have very low risk for infection. Diabetics, of course, have a little bit higher chance of infection, but again, that still is very low. And we do, again, give you the antibiotics during surgery, as I mentioned before, so usually we don't see issues with this. As far as when to call us after surgery, any changes in strength as far as worsening strength, increased weakness, things of that nature we want to know about. Any increasing symptoms, increasing pain, numbness, tingling, please let us know. As I've said before, it's normal to still have some symptoms, and even some days are better than others. You might just feel sore more one day versus another, but as long as it's just up and down and overall things are improving, we're okay with that. But if all of a sudden you're having escalating symptoms that are not calming down, please let us know. Any persistent fevers, redness, swelling, drainage, increased drainage, things of that nature, any signs of infection with the wound, please let us know that as well. And any persistent nausea or vomiting, also give us a call. We're happy to use some anti-nausea medications and help deal with that as well. As far as when you will see us next, typically we'll see you back at your first post-op visit, which is about 7 to 10 days after surgery. At that visit, we will remove any steri strips and sutures. We'll get x-rays and review those with you. We'll answer any questions that you have. Overall, just review how you're doing, refill medications if needed. We'll go through all of that, talk about return to work if you haven't already returned, talk about driving, all of those types of things. And as I said, typically after this appointment, if you haven't already, we will clear you to drive as long as you're not taking the pain medicines throughout the day. We'll then see you again at 6 weeks after surgery, and at that point we'll start lifting the restrictions that we placed on you as far as the bending, twisting, and lifting, and we'll get you started in physical therapy. So getting you back to normal, after that 6-week post-op appointment, as I just said, we'll get you into physical therapy to work on strengthening and stabilization of your core muscles and get you feeling stronger again. We'll give you an order for that and help you get that set up if necessary. You can gradually increase those at normal activities in conjunction with starting that physical therapy. So you can start gradually increasing your bending, your twisting and lifting, but being still smart about using proper body mechanics with those motions. The physical therapist then can guide you as you're getting stronger to get back into your normal exercise routine, sports, physical activities, whatever it is that you like to do. And typically, as long as everything's going well and you're doing well after that point, we do not see you after that 6-week appointment on a regular basis. We're always here for phone calls if you have questions, concerns, or you can follow up if you had questions or concerns at any time. So hopefully this video has given you a lot of information as far as the procedure, the day of surgery, and the recovery period goes. Always please feel free to call us if you do have any questions at any point. Thank you.